Well, welcome to an Ask an MS Expert Veterans Program. My name is Emily Riley, and I'm the moderator for this wonderful program. I am a proud Air Force wife, dog mom, certified personal trainer who teaches adaptive fitness classes for the MS community, and I've been living with MS for over 17 years. I'm currently located at Scott Air Force Base in Southwest Illinois. Thank you for joining us. The National MS Society is committed to offering a place to connect and ask questions to MS experts on topics impacting veterans affected by MS. MS navigators are online throughout the program answering questions and providing resources. So please post any questions or comments that you may have in the comments box on Facebook, YouTube, or Twitch. I would like to acknowledge and thank today's national sponsor, Lockheed Martin. Support from MS community partners help the National MS Society reach our goal of providing up-to-date information and support through programs like Ask an MS Expert Veterans Program. A healthy diet can help manage MS symptoms, promote the long-term health of your nervous system, and prevent other conditions. Dr. Budgetfriendly is joining us to talk about healthy nutrition through a well-balanced meal, the latest research on diet and MS, and she'll share valuable resources for veterans that promote healthy eating. Dr. Yadav is a professor of neurology and director of the MS Center at Oregon Health and Science University. She is director of the Joint MS and Neuroimmunology Fellowship at Oregon Health and Science University and VA MS Centers of Excellence West. Dr. Yadav is also assistant director for clinical care for the Veterans Affairs MS Centers of Excellence West. Well, I'd like to welcome Dr. Yadav. Thanks so much for being with us today.
Thank you, Emily, for a nice introduction, and very happy to be joining this program. Hopefully, we'll have some good learning sessions for our veterans. Nutrition, of course, is a hot topic for all of our patients with MS, so I'm excited for this program today.
Yeah, me too. I even have a notebook ready to take some notes. So, so maintenance of good general health is important for people with MS or any chronic disorder. Mm-hmm. A well-balanced and carefully planned diet will help achieve this goal. And so for those with MS, we know that what and how you eat can make a difference in your overall health. So to start, what is the difference between diet and nutrition, and how are they connected?
I think you asked a very good question, actually, because people usually confuse between what is diet, what is nutrition. Nutrition is actually a science. Nutrition is the process of how we utilize food. Food is what we eat and drink, so that is diet. So nutrition is more of a science of how the process of utilizing the food to maintain your body health, body growth, metabolism, all of that. So that's kind of nutrition. So they're completely intertwined, they're completely interconnected, but at the same time, the concepts are different.
Interesting. So I know there's like so much information out there about the different diets and foods to avoid, and it can be really overwhelming. So what does a healthy or balanced diet look like?
So in general, I would say, the US dietary guidelines, which are definitely put up by the experts in the field, which are revised usually every 5 years. They're the best resource for what is a good diet. And they have been evolving, they have been changing over, I would say, several decades now. Mm-hmm. So I would really say that, it doesn't matter whether you have MS or not, US dietary guidelines are the best resource for all of us to be following those recommendations. And they do change in accordance with the science. I think they are truly the science-based recommendations.
Okay, that's helpful. So what does research tell us about how diet and nutrition can affect someone's MS symptoms?
So diet in MS, I would say it's a simple concept also, but at the same time, very complex concept at the same time. There's a lot of confusion about what is right nutrition, what is right diet for MS patients. And to tell you the truth, I've been doing the diet research for almost 20 years now, 15, 20 years easily. Mm-hmm. And I still cannot really tell you for sure, what is the right diet for MS patients. For example, our own group has been looking into low-fat diet, which was influenced by a diet called Swank diet, which was extremely low-fat diet. Mm-hmm. Then along the way, in the last, I would say, 15 years, many other diets have been tested. So Mediterranean diet, there's a Wall's protocol, or this is more of a modified paleo diet or a ketogenic diet. All of these diets have been tested. they have been tested in small duration. For example, they are like 3-month long, 6-month long, 1 year long, but nobody knows the longer term effect of any of these diets. So I think we have to be very careful when we recommend to the patients about any diet. What is the duration of that particular study? So long-term data has not been, especially long-term safety and the long-term effect has not been tested. So I think we have to be careful as especially healthcare provider, what we are recommending to our patients.
That's true. Is there a connection between like gut health or inflammation or MS symptoms?
I think that's also a very fascinating field. I'm not sure there's enough research at this time that we can really connect the two MS and gut health, but I think there's emerging data that supports that. Healthy eating definitely improves the overall health, including gut health. So that should be beneficial for our patients. But what defines a food which will improve gut health is still not very clear. I would say that literature will probably come from more from the GI, like gastroenterology folks, where, for example, the inflammatory bowel disease, that's a very well-known entity, and there are specific diets which are recommended for that, that kind of disease state. So I would follow those recommendations, but the same diet, can that be implemented for MS patients? That is not really clear at this time.
Okay. So we're still waiting on more information.
Absolutely.
Okay, so we got a question from Kathy, and she's wondering what foods should people with MS eat more of or add to their diet to minimize symptoms or exacerbations?
So one of the things which some of the studies have shown very strongly in the MS world, low-fat diet, Mediterranean diet, as well as like this modified paleo diet, 3 of the diets have shown to improve fatigue in MS. And if you look at the core of all of these 3 diets, they all focus on sort of, eating naturally, meaning unprocessed food, eating the right balance of fat and like right amount of carbs or type of carb that they should be consuming, limiting certain factors. So if you look at these 3 diets, they all focus on healthy eating, which is actually very similar to the US dietary guidelines. So fatigue definitely is one symptom that can be improved by improved eating. And I truly believe whether it's a low-fat diet that, that we have tested in a small study, or Mediterranean diet, or this modified paleo, can possibly impact that.
Wow, that's really interesting and helpful.
Correct. And the other thing which, in addition to the fatigue, whenever most of these 3 at least diets have shown improvement on mood as well. So emotional health can be improved, and there is enough evidence, I think, which is emerging, which is showing that food and emotion is connected. I mean, we know about emotional eating very well, how a person's mood can impact their dietary habit is very well known. So these things are really valid in MS patients as well.
Interesting. Yeah, it's so interesting how it's all so interconnected, right?
Absolutely.
So you kind of touched on this a little bit, but individual dietary needs can vary. And so I know it's important for veterans with MS to work closely with healthcare professionals who can tailor advice to their unique circumstances and medical history. So we heard from Alex, who takes medication for high blood pressure. He's wondering if there's specific dietary guidelines for people with MS who are also dealing with other health conditions such as like diabetes or hypertension.
Absolutely. So I think definitely working with the primary care provider or the healthcare provider who's managing the blood pressure is absolutely critical. There is enough evidence about the role of diet in improving blood pressure, or diabetes, for example. These are well established. So DASH diet, which is a dietary approaches to stopping hypertension, is one of the diets which actually is a very healthy diet. So healthy diet, so that can definitely be implemented by anybody who has hypertension, MS or not MS, and there's no data to show that would be harmful to the MS patients.
Okay, great. And Vanessa, she wrote in and she said she experiences a lot of stress and anxiety and is wondering if there are certain foods that can help reduce stress levels. You kind of mentioned a little bit of how some foods might help with mood. So are there certain foods that can help reduce stress levels?
That's a very, very fascinating field. I mean, in my opinion, I personally feel food definitely is connected to how we feel, and in vice versa, in how we feel and what we eat. they go sort of hand in hand. In general, when people are stressed, I think they tend to go towards kind of what we call comfort foods, which are like mostly fatty foods or sugar. And, I think all of us have probably gone through that phase, and we probably go through that several times a week or maybe more, with the stress that all of us have in our lives. But it's hard to eliminate those things like very readily. So I think learning sort of ways to minimize the craving that you have for sugar or the craving that you have for fat, time to time, is a good way to learn. These are habits that we can learn with practice. But it can be hard though. I think working with a counselor sometimes can be very helpful. Working with coaches can be extremely helpful. There are nutrition coaches which can be very helpful, and dietitians or nutrition, all of them. There is enough support system. I think within at least a VA, we have very good programs that can really help with these kind of interventions. So reaching out to those people, if people are not able to control their cravings, is a great way to deal with it.
Great. Yeah, I think we'll touch a little bit more on those resources later, but I think, like you said, it's really important to work with your healthcare providers on specific needs. So Brian deals with fatigue every day, and he's wondering what dietary strategies you would suggest to manage fatigue and enhance his energy levels. You touched on this a little bit, but if you want to dive a little deeper into maybe some strategies that might help with fatigue.
One thing that I also struggle with in my own clinic is what do you advise our patients who struggle with fatigue, like MS patients who are struggling with fatigue? It's a very common symptom. Almost more than 70% of the patients will have fatigue to some extent. And I think among all the symptoms, fatigue is probably one of the most disabling symptoms and causes of disability. So it's a real problem in our patient population, and health, I think the diet definitely can play a role. I told you some of the studies that have been done using the low fat diet. And when I say low fat, I'm specifically targeting the fat, total fat, or like the saturated fat combined to be less than 25%. So the way you define, let's say like calorie-wise, we are 2,000 calories per day. Somebody is consuming total calorie 2,000 per day. So 25% or less of that should be coming from fat, and 10% or less should be coming from saturated fat. So I think if you can achieve that kind of goal, that may be able to help with the fatigue. And again, I'm talking about the studies that we have done ourselves, like 2 of the studies that we have done recently showing that. On the other hand, if you look at the Mediterranean diet, that's not a low-fat diet. Or if you look at the modified paleo diet, that's not a low-fat diet, but that also has shown to be improving fatigue. So fat alone is not the only factor for improving fatigue. So there has to be other components, which I think we don't understand them yet. What I can tell you, the food which is like unprocessed, like for example, if you're taking lots of green vegetables, lots of the right nutrients for right nutrient, meaning like minerals and vitamins which are coming from plants, that can actually help with improving your overall metabolism, overall metabolic state. So that can improve fatigue as well. What I'm saying may sound very kind of simplistic and maybe not very vague, in a way vague, but trust me, like when we did these trials, people were consuming, like for example, the total consumption of fat was approaching 40% of the total caloric intake. We were able to bring down the fat composition to close to 23%. And so that's a big change, in the fat, and that alone was able to show the changes in fatigue in these small trials. So I'm just saying, like, we can study these things well, but I think sugar, I'm not very sure. Everybody agrees that simple sugars are not good for you. But I have not seen studies which have specifically looked at the connection of simple sugar and fatigue. Okay, so those studies I think probably need to be done and see if the sugars can be directly correlated with fatigue or not. But that study, to my knowledge, has not been done in MS yet. So these are just examples of how you can study and how you can target specific what we call nutrients which can improve your fatigue level. But a lot more has to be learned. I'm not sure we are there yet.
Yeah. Sounds like as long as your plate's colorful with all the fruits and veggies and stuff, that's a good start, right?
Absolutely.
All right. So as a fitness professional, I appreciate this question. Michelle's trying to lose weight by eating a healthier diet, but her friend suggested that she starts exercising also. So Michelle's wondering, what role does exercise play in combination with a healthy diet, and how can someone find the right balance between physical activity and nutrition?
I mean, I completely agree with the struggle that, patients have in managing their weight. It's a huge problem. I mean, if you look at the US data, 70% of our population is either overweight or obese. So it's almost like an epidemic, in our country at least. So it's a huge problem, and similarly will affect our MS patients. And of course, directly connected to diet and exercise in our lifestyle, because we all have become sedentary. We're all doing things, sitting on our computer, sitting on our tables, and so it is not a healthy lifestyle anymore. So exercise plays a huge role then. Choosing the right diet, absolutely critical, but exercise also is very important for maintaining your muscle health, and not only muscle health, but the cardiovascular health is so important, and that can only be achieved by doing the right amount of exercise. If you look at the guidelines for the recommendations for exercise in MS, so the current recommendations are to do at least 3 to 5 days per week of moderate to higher level of physical activity, which should be at least 30 minutes. And of course, our patients, they range from anywhere who's completely physically active to people who are completely wheelchair bound or extremely limited with ambulation or physical capacity. So you have to tailor the physical activity according to each individual's disability level. So there are people with MS who are marathon runners. On the other hand, there are people who are bedbound completely. So, any exercise that anybody can do at their level is good.
Yeah.
And of course, everything takes time. You need to have time for proper food consumption. You need to have time for exercise as well. So finding the time for both of them is really critical. I personally feel as a healthcare provider, I struggle with finding time for myself. So I think I can imagine the struggle that patients can have who have limitations with so many different aspects. So I think, but at the same time, I think health is the paramount asset that all of us have. And if we do not really find time for that, then what are we doing? So I feel finding time and doing the right, whatever you can. Again, it doesn't have to be stressful. You should not be stressed about, look, I have to do this. But even if you do it at least 3 to 4 times per week, I think that should be good enough to give you the health benefits of exercise. Of course, diet is a daily, everyday stuff that we have to do.
Yeah. Yeah. I always say any movement is good movement. So
absolutely,
I agree with you. All right. And then we heard from Carter, who wants to know if you have any tips for practical meal planning and preparation that'll make it easier to have nutritious and accessible meals throughout the day. And I know for me, it's really important to be proactive. You talked about fatigue, and often, if we have some things prepped, then maybe that might help with fatigue. But I'm curious if you've got any practical tips.
I think planning definitely helps a lot. It's especially the way our lifestyle is currently, it's very hard to do cooking every day. It's almost impossible to do cooking every day, or forget about every day. If you can do cooking even a few times a week, I think that's kudos to you, or whoever is able to do that. So I think planning and trying to prepare food in bunches or in bulk would be a good option, wise option, because especially if they're working, you have to be very organized. You have to be very organized and trying to do things together on a weekend, and sort of plan on a daily basis what the meal should look like. I think that probably starts there. Everything needs time. Again, I'm emphasizing that again and again because that's what I found people struggling with. They do not have time. But the thing is, you have to get the time for these things, and be vigilant. Be aware of what is. Where are you spending time, and carve time for these, because these two things are probably the most important aspect of your life and health in general. So meal preparation would be as I said, prepare in batches, prepare in bulk, buy in bulk, because that would be cheaper as well, because food has become expensive. If you look at, especially with inflation, and all of us are affected by that. So in the last few years, the cost of food has risen so high. So preparing meal and also in bulk would be cheaper, and hopefully can maintain, can meet our goals of healthy eating.
Yeah. Yeah. Because if we have some stuff prepped, then we'll make healthier choices.
Absolutely.
That'll promote health. So great. Thanks for those tips. All right, we're going to kind of shift gears a little bit and talk about some resources and services that can help support veterans living with MS to reach their goal of a healthy diet and overall well-being. And so the Veterans Administration uses like a whole health approach to care. Can you explain the benefits of whole health and how diet and nutrition fit into this approach?
I feel VA has done a marvelous job of really paying attention to the overall health of the patient. So this whole health program, I think it's an amazing program. You can be referred, actually, you can either call your primary care provider or send a message to them, or this MOVE program that they have, move.va.gov also is a program that you can actually just call and get assigned to that program. And these are programs which are done. I think you can have one-on-one coaching, you can have group coaching, you can have, I think even meal preparation, all of those, you have access to the dietitian, you have access to the nutritionist. All of these things are well embedded within these programs. So I think it would be absolutely worthwhile for every veteran to be part of these things. And you will learn for sure. I mean, there's no way that you will not really learn about what resources are there and how you can incorporate that into your daily practices, and also work with a healthcare provider by utilizing these resources.
Great. So to clarify, do veterans have access to a registered dietitian and nutritionist? And
Absolutely. Through the whole health program, as well as through the MOVE program, you will have coaching, counseling, everything is available to every vet.
Okay, great. So the MOVE weight management program, I know accountability is a really helpful tool, to help people stay on track. So that sounds like a really great resource. And we had somebody actually ask about the MOVE program. And so we'll make sure to share that resource in the comments below. All right. So Stan wants to learn how to cook so he can eat better on a regular basis. He learned about the Healthy Teaching Kitchen program at the VA. Can you tell us about that program and how veterans can determine if their local VA facility even offers the program?
I think that probably would be best to go to the website and look at, because I cannot really tell you within each, because again, the VA has all these different visions and different resources, like big facilities, small facilities. It's hard to say whether every facility will have these resources, but if you go to the website and look into which your local area would be, the local VA for you would be, and a lot of it is online programming, so you will have the access to that. So, and you can definitely ask your primary care providers usually are the best resource to get into all of these things. But yes, most of these programs are deliberately made online now so that you can have access to them virtually.
Wow. So great to know that there's resources to empower veterans with skills and tools on how to cook healthy and learn about all these things. So definitely check that out. That sounds great. I know you've mentioned this a few times, but will you share the community or online resources that focus on diet and nutrition? You've mentioned a government specific resource.
Yeah. So I would say the choosemyplate.gov, which is basically the USDA, the US Department of Agriculture, and they are the ones who come up with the dietary guidelines, the US dietary guidelines. So they have excellent website. I truly mean excellent, because they really will give you breakdown of what you should be eating, how much you should be eating, what your plate should look like. So I think that's probably the best resource, which is completely supported by science. So I think that is truly, in my opinion, for nutrition, that's the best website. And then the National MS Society has done an awesome job. In fact, a group of researchers and doctors, we got together and we put together this whole sort of review of nutrition and wellness in MS. And then so the National MS Society website also, if you just type in diet and nutrition and National MS Society, it will take you that page. So that also gives you sort of evidence-based guideline of different diets. So I think reach out to that resource for sure. And then, of course, the VA resources that you have. So I think between the three, I'm not sure you need more than that, because they are really plentiful. I mean, you truly will get the science-backed evidence for the diet there.
Great. And I'm sure before anybody decides to make any changes to their diet, probably talk to their healthcare provider, right?
Absolutely. Because I think People have different medical conditions, different medication that they're taking. So what diet they will be choosing, what food they'll be choosing should be, should be discussed with their providers, definitely. And I think more and more, definitely primary care providers are the resource, but I think in general, other providers are also becoming more open to the diet questions now.
Good. Wow. Well, you have shared some very valuable information today, so many good nuggets. And so I'm curious, what are your 3 top takeaways that our audience can maybe begin to act on right away?
My first kind of thought would be that diet and nutrition truly play a very critical role in staying healthy. So do not underestimate the power of diet and exercise both. So I think, in my opinion, those diet and exercise are more important than medications, and you can reverse many diseases, including diabetes, including obesity, including hypertension, by diet and exercise alone. So there is this whole concept of lifestyle medicine, which has sort of evolved over the last 2 decades, where the focus is how do you treat chronic diseases with diet and exercise and lifestyle alone. So I think definitely these things play the most critical role in staying healthy. So please follow that. Mm-hmm. As of yet, there is no special diet for MS. So yes, you will hear that, you will hear the buzz in the news about this diet or that diet, but frankly, there's no one diet. Diets are being investigated, yes. So they have shown benefits in certain aspects, but I still cannot really tell you that this is the diet for MS. And then thirdly, I would say definitely work with your healthcare provider very openly about every question that you have about diet, and they'll be more than happy to help you in your journey towards healthy, outcomes.
Great. Awesome. Well, thanks for re-highlighting those 3 important points. We have a little bit of time for some questions. And so Krista wants to know, what is intermittent fasting, and is there any evidence that intermittent fasting has an impact on MS?
So when we talk about intermittent fasting, that means we are trying to cut the calories. So the total calorie that you consume per day can be reduced by, that's a voluntary effort that you want to cut back on the calorie by limiting the number of items that you're consuming, or limiting the number of calories that you're consuming. And it can be done in a variety of ways. So that's caloric restriction. So caloric restriction and intermittent fasting, they sort of go hand in hand. However, intermittent fasting is something which you could restrict the calorie, and then you consume whatever amount of calorie the next time. If you do not restrict the calorie overall in 1 week period, you will not really lose weight actually. So I think overall, when you are limiting calorie, it should be visible in about 1 week period or some pattern. That's when it will meet that sort of criteria for intermittent fasting. So one of the two of the studies which have been done in MS with caloric restriction, they have used different patterns. One of the study included limiting calories by reducing it by 22% every day for all days of the week. Second approach was limiting calorie by 75, so decreasing the calorie to 75% of your caloric intake twice a week, and then rest will be 100% of the caloric intake. So when the study, this was a John Hopkins study, which was looking at these 2 approaches, they found, as compared to the control where they did not do any restriction of the calorie versus these 2 groups, the 2 caloric restriction group had decreased in weight, so they lost weight, and they also had improvement in fatigue as well as emotional well-being compared to the control group. So showing that there's some connection between the caloric restriction and the subjective symptoms like fatigue and emotional well-being. Another study was also a very small study, in about 17 patients or so. They looked at cutting the calorie by 500 kilocalories per day. So they had used a very specific criteria of what they will call as caloric restriction. So that also showed improvement in fatigue. But these are very small studies. We have not tested them for a longer term, 6 months or 1 year or 2 years. So it's hard to say what the long-term implication would be. Short term, they look safe and effective in some symptom, but longer term, it's hard to say.
Interesting. Yeah, it sounds a little complicated. Maybe it's helpful to have a nutritionist kind of guide, because I've often heard intermittent fasting is also within time restraints too of when you can eat. And I don't know if there's a difference between caloric restriction versus within a specific amount of time. So
no, I agree with you. So I think working with a dietitian and nutrition will be the best way versus trying on your own. You can run into nutritional deficiencies or kind of malnutrition. So these can be very common. They can really cause real medical issues. I think be careful, whatever approach, do not follow any extreme approach. I think that's not advisable.
Yeah, no, that's really helpful. Good advice. This next question is interesting because you kind of touched on it a little bit earlier, but so Sylvia is living on a fixed income and is wondering what are some budget-friendly, healthy options when grocery shopping? You did mention like bulk buying, but I'm curious if you have any other budget-friendly, healthy options when grocery shopping.
That's a hard one actually, because I really feel like food has become so expensive. So how do you manage what we are recommending is like eat healthy and like at the same time like getting fruit like this fresh fruit and vegetables is not that easy. So I would say again, buying in bulk at the same time, even frozen food actually can be very healthy. So frozen fruits and vegetables, especially when you're buying them in non-prime season, when especially in summertime when you can get cheaper, especially the berries and all, which are considered to be superfoods. They are not very cheap actually in the off-season time. So having food which is frozen would be fine. I would say that again, using the resource of, for example, this myplate.gov website has a really nice option of healthy eating on budget. So I think that would be a great resource, and maybe we should put that link here about for anybody who wants to look at how can you eat on a budget. That would be a good resource for people to look into.
Awesome. Love it. Wow. Well, so many great questions that we received, and thanks to everyone who submitted comments and questions. And thank you, Dr. Yadav, for being with us today. I would like to remind everyone that you can connect with an MS Navigator via phone, email, and through the Society's website via chat. For information and resources on MS, visit the Society's website. You'll find research updates and news, self-help groups just for veterans and active duty military, and more ways to get involved and upcoming events near you. You can connect with the National MS Society and others affected by MS via Facebook, Instagram, Twitch, Twitter, YouTube, and LinkedIn. I encourage you to like, subscribe, and or get on the Society's mailing list to continue to receive up-to-date information on MS and updates on upcoming programs. I want to thank Dr. Yadav for sharing her knowledge for everyone's engagement in today's program. The recording will be made available on the Society's website at nationalmssociety.org/MS expert. I invite you to join us in November for our next Ask an MS Expert Veterans Program. Lastly, it's important to get your feedback on today's program. You'll see a survey linked in the comment section or in the program description on Facebook, YouTube, and Twitch. Completing this survey makes a difference, and it only takes 1 minute to complete. The information you provide helps continuously improve and shape future segments. So thank you so much for joining us today, and we will see you soon.